A 35-year-old pregnant woman comes to the clinic for her prenatal visit. The nurse gathers data about her obstetric history. She has a 3-year-old twins at home and had a miscarriage 10 years ago at 10 weeks gestation. How would the nurse accurately document this information? Gravida blank, para blank. The correct answer is Gravida 3, para 1. Rationale. Gravida is a number of confirmed pregnancies, and each pregnancy is only counted one time, even if the pregnancy was a multiple gestation in case of twins or triplets. Para or parity indicates the total number of pregnancies that have reached the age of viability, which is 20 weeks, regardless of whether the infants were born alive. This woman who is now pregnant had 2 pregnancies and 1 viable birth, which is the twins. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Option A, trichomoniasis. Option B, staphylococcus. Option C, chlamydia. Option D, streptococcus. The correct answer is option C, chlamydia. Rationale. Chlamydial infections are one of the most frequent causes of salpingitis or pelvic inflammatory disease. Chlamydial bacteria could travel up toward the vagina or cervix into the reproductive organ. A nurse is to administer meperidine hydrochloride or Demerol 100 mg, atropine sulfate 0.4 mg, promethazine hydrochloride 50 mg IM to a preoperative client. List the order in which a nurse must carry out the following actions prior to the administration of preoperative medications. Option A, instruct the client to remain in bed. Option B, have the client empty the bladder. Option C, place the call monitor within reach. Option D, raise the side rails of the bed. The correct order is option B, to have the client empty the bladder. Then option A, instruct the client to remain in bed. Option D, raise the side rails of the bed. And then the last one is option C, place the call monitor within reach. Rationale. First, have the client empty the bladder. Have the client urinate before administering preoperative medication. If the client does not have a catheter, it is important to empty the bladder before receiving preoperative medications to prevent bladder injury, specifically for pelvic surgeries. Otherwise, a straight catheter or an indwelling catheter may be ordered to make sure that the bladder is empty. Next is to instruct the client to remain in bed. Giving preoperative medications which can cause drowsiness and lightheadedness places a client at risk for injury. The next step is to raise the side rails of the bed to help prevent accidental falls and injury. And finally, place the call monitor within reach. It is an important device to help assist the patient whenever needed. Which individual is at the greatest risk of developing hypertension? Option A, a 45-year-old African American lawyer. Option B, a 60-year-old Asian American business owner. Option C, a 40-year-old Caucasian nurse. Option D, a 55-year-old Hispanic teacher. The correct answer is option A, a 45-year-old African American lawyer. Rationale. African Americans develop high blood pressure at younger ages than other groups in the U.S. Researchers have uncovered that African Americans respond differently to antihypertensive drugs than other groups of people. They are also found out to be more sensitive to salt, which increases the risk of developing hypertension. Which complication of cardiac catheterization should the nurse monitor for the initial 24 hours after the procedure? Option A, angina at rest. Option B, thrombus formation. Option C, dizziness. Option D, decrease in blood pressure. The correct answer is option B, thrombus formation. Rationale. A thrombus formation may prevent blood from flowing normally through the circulatory system, which may become an embolism and block the flow of blood towards major organs in the body.